Hi, I'm Laura Volstad of Volstad Chiropractic and Integrated Wellness, and welcome to the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. Some topics we'll cover will include spinal issues like neck and low back pain, bulging discs, pinched nerves, sports injuries, lifestyle medicine, dietary and nutritional advice, and nutraceutical supplementation, just to name a few. And yep, there's more. We'd like to encourage you to email us about any topics that you'd like to hear discussed on this program. You can email us at imchiro1, the number 1, at gmail.com. That's I, M as in Mary, CHIRO, the number 1, at gmail.com. Today we want to introduce you to chiropractic. Just what exactly is it? What's the role of a chiropractic physician? We also want to talk about the educational training a doctor of chiropractic, or a DC, has to go through to earn his or her degree and license. You might be surprised to learn how rigorous that process really is. I know I was. Also, we're going to talk about and maybe change some perceptions you might have about chiropractic and its role in mainstream healthcare today. So, let's get started. I'd first like to introduce my husband, Dr. Keith Volstad of Volstad Chiropractic and Integrated Wellness, who's a 33-year veteran practitioner of chiropractic. Dr. Volstad, I'm familiar with you, of course, but tell our listening audience maybe a little bit about yourself.
Be glad to do that, Laura. As you said, I'm a 33-year practitioner. I've been in practice since 1982, and I've been in Jupiter since 2013. I am licensed in the state of Florida. I have certifications in sports injuries, spinal disability, and I'm also board eligible as a chiropractic internist and a clinical nutritionist. What that means is I've completed the required postgraduate training, and I'm eligible to sit for the boards in these two specialties. Just to let you know, I'm also a certified acupuncturist, as I have the state-required certification to practice chiropractic here in the state of Florida. So there you go, a little bit about me.
Well, thanks. That's the short version of a very long career and lots of education. So share with our listening audience a little bit about what chiropractic is.
Okay. I guess the definition, and I'm going to read it real quick. The definition is, chiropractic is a healthcare profession that focuses on the disorders of the musculoskeletal system and the nervous system and the effects these disorders have on general health. Doctors of chiropractic, then, are referred to as chiropractors or chiropractic physicians, and we practice a drug-free, hands-on approach to healthcare that includes patient examination, diagnosis, and treatment. Now, that's the official definition, and I think it's summed up pretty well. But just to add, I think chiropractors are also more involved in holistic healthcare as well, talking to patients about their body's needs as it pertains to their entire health, not just their neck or their lower back or their shoulder or their knee, but a much more holistic approach. We as chiropractors have that broad diagnostic skill, and we're trained to recommend therapies and rehab exercises. We can also provide nutritional and dietary and lifestyle counseling. We assist our patients, as we said earlier, through clinical examinations, and many of you may not know this, but we are licensed to order laboratory testing, diagnostic imaging, and other diagnostic interventions to determine when our treatment is appropriate and when it's not. You got to remember, chiropractors will readily refer patients to the appropriate healthcare provider when what we do isn't really suitable for what your condition may be. Or we may need to co-manage the patient with other members of the healthcare team.
As I've learned more and more about chiropractic, I've learned it's not only about backs and necks and joint injury, which was my perception for many, many years. But what else do DCs do to help their patients in their healthcare needs?
Well, as I stated earlier, chiropractors are holistic healthcare practitioners. We try to pay attention to the entire body. And in doing so, we utilize things such as dietary and nutritional management. We'll talk to patients about what they're eating, what maybe they could do to improve their diet, and then how these things pertain to the health issues that they may present with. We talk about lifestyle management and exercise recommendations, and these two things kind of go together.
Right.
You know, what's the stress in your life? What's your job like? What's your family life like? All of these things can play into what your health needs are, and we want to know about that, and then maybe try and do something to help you deal with these things, or give you avenues and suggestions about how to handle these things so that they don't become such an effect on your health. Then the other thing that we do, and this is something that's kind of near and dear to me, and that's functional medicine. Functional medicine is a kind of a new area in medicine in general. Medical doctors are doing it, osteopaths are doing it. Functional medicine is the utilization of clinical laboratory testing, such as blood work, testing your thyroid, your heart, your sugar, those sorts of things. And then coming up with ideas about the things I've the things that I've mentioned, such as nutritional, dietary, lifestyle management, exercise management, to help the patient recover and restore health to their body. So what do? Well, we utilize physical examinations. We may examine your heart or your abdomen or your back or neck. As a chiropractor, everybody associates neck and backs with chiropractors.
Right.
We'll do physical examinations of the different areas of your body depending on what your needs are. We may order specific blood tests. A lot of people don't realize that as a chiropractor, I'm a quote-unquote primary care physician, and as such, I have the ability and the training to determine what blood tests you might need and then order them for you. Saliva tests. We can get so much information about the human body from saliva. Hormone testing, just to name one. We might utilize a urine test, something that's not very difficult to do, but can give us a lot of information about what's going on in your body. And then from an x-ray perspective, I have an x-ray machine in the office. So when patients come in, we can certainly x-ray areas of the body. Or we may refer a patient out for magnetic resonance imaging, an MRI, neck, low back thing, that sort of thing. Some other types of testing we might do would be genetic testing. There's a company called 23andMe where we can, utilizing saliva, get your complete genome as a patient. And from that, we can look for maybe some mutations that are evident in your genome that could be creating some problems with the way your body is physiologically functioning, and then make suggestions and corrections to help you overcome these shortcomings.
Right. I know that was it was fascinating when I did that and got those results back. It was very interesting, and it will also tell you what your ancestry is.
That's the fun side of
so
this thing.
Fun.
If you go to 23andme.com on your computer, on the internet, you can see what kind of things they do, because that's what they do mostly, is look for your ancestry.
Right. Some things I knew, some things I didn't.
Yeah, you might be surprised what's lurking in your past. But getting back to some other testing that we can do, Doppler exams. We can order Dopplers to evaluate the vascular integrity in your arms and legs. We can order and do EKGs. Listen, get the information that we need about your heart. The another one is spirometry. Very useful tool for evaluating lung function. Now, it is true that here in the city of Jupiter, or the town of Jupiter, I should say, there are many highly qualified and fine physicians that would do this work for us, and I have no hesitation in referring you out for that sort of thing. I just wanted to let you know that we are trained and qualified to do some of these things, even though we may not do them in our office. So that's a little bit more about what chiropractic can do relative to taking care of the entire body for your patient. So
it really is head, shoulders, knees, and toes. Knees and toes. We need the preschool here to sing us that song.
That's right. It's from head to toe. Even though we may not be treating you or end up treating you for a specific condition that you have, we certainly are trained to diagnose these things and then, when necessary, get you to the appropriate healthcare provider that would give you the treatment that you need.
Right. We need to add to that song, too. You know what we need to add?
What do we need to add?
Elbows, wrists, and feet.
Elbows, wrists, and feet.
We'll have to figure out how to work that one in.
Okay.
Dr. Volstad, you mentioned a minute ago about how rigorous the training is to become a chiropractic physician. Why don't you share with our listeners just what that was all about, what education training is required?
Okay, Laura, I'd be glad to do that. I think a lot of times patients, or the populace in general, I should say, don't realize how rigorous the training is to become a doctor of chiropractic. I think everybody's pretty familiar with what is required to become a medical doctor, but they think maybe because we're just chiropractic physicians that maybe our education isn't up to what a medical physician's education is. And I think after you hear this, you might be a bit surprised as to the level of education that a doctor of chiropractic has to go through before he can earn his degree and then move on to be licensed by the states where they want to practice. Mm-hmm. For example, I'll use myself as an example. I have a 4-year Bachelor of Science degree from Purdue University. Boo, as I'm an IU fan, if for any of you that are familiar with that.
Yeah, we'll talk about that a little later. How could you be an IU fan when you graduated from Purdue? But okay.
Well, anyway, I have a Bachelor of Science degree in biology from Purdue. That is a 4-year degree, after which then I applied to and was accepted into a chiropractic school. The name of the school was the National College of Chiropractic. Today it's known as the National University of Health Sciences, and it's located in Lombard, Illinois. It is a 5-year program. Now, I've read on the internet where some people talk about how you can go through chiropractic school and it's only 3 years. What they don't tell you and what they're not being forthright with on the internet is, yes, you can go through chiropractic school in 3 1/3 year, but it's going all year round. That means you don't take the summers off. You're in school the entire year. Chiropractic school is a 10-semester or 5-year program, which includes a year of internship/residency, which you must complete. Just to give you an idea, this is information garnered from catalogs of chiropractic schools as well as medical schools, and we're going to throw in physical therapy school too, just to kind of give you a comparison. The average length of the program for chiropractic and medical school is 4 years. Physical therapy is 3. The average classroom and clinical study hours prior to graduation from a chiropractic or medical school or physical therapy school is as follows. Chiropractic school, 4,820 hours of classroom and clinical study. Medical school, the average is 4,670 hours. And for physical therapy school, it's 3,398. So as you can see, to receive your Doctor of Chiropractic degree, we have as many clinical and classroom hours as the MD does when he graduates from medical school, and actually more than the physical therapist does when they've graduated from their physical therapy school.
Are they the same type of classes? I would imagine they differ in some ways, but you all still have to do anatomy, physiology,
That's a
all
great
that.
question, Laura, and the answer is, for the most part, yes, they are the same. For example, I know if you review the curriculum of the medical schools versus the chiropractic schools, they are going to have more hours in pharmacology because they utilize pharmaceuticals where chiropractors don't. Now, I'm not going to say that we don't get some training in pharmaceuticals, because we do. It's just not nearly as extensive as a medical doctor's training. However, on the other hand, from an X-ray perspective, we get significantly more hours of X-ray education and training than an average MD does when he gets out of medical school. Now, of course, the medical doctor can go on to residency as a radiologist, which would give him an expertise that would be greater than the average chiropractor's training. I understand that. But the chiropractic profession also has a residency in radiology, which would also improve and increase their technical and expertise in those areas. That's the other thing I did want to mention, is that as with the medical profession, the chiropractic profession also has their postgraduate residency training. So like the orthopedist in the medical profession, there is the orthopedist in the chiropractic profession. As there is an internist in the medical profession, there is an internist within the chiropractic profession. And as I mentioned earlier, that's exactly what I've just completed here recently, is my postgraduate work at residency in chiropractic internal medicine. Physical therapists, just to be fair, also have advanced certification that they can take part in as well. So I think what I'm trying to demonstrate here is that from an educational / training perspective, chiropractors are very, very rigorously trained and educated and very knowledgeable within their areas of expertise.
Okay, thanks, Doc. I was surprised to learn that as well, so thanks for educating us on that score. Now I'd like to direct our attention to some perceptions our listeners might have concerning chiropractic. Doc, how many times have you heard a patient say, "Doc, my neck is out. I just need you to pop it back in"?
That's a very common comment that I hear from patients in the office. Yeah, and I'd like to address that because it does demonstrate what I believe to be a misconception that chiropractic patients have about what chiropractors do. So often they say things like, my neck's out of place, or I got a bone out of place, or a disc out of place. Just pop it back in for me. And I'd like to take a few minutes here to try and correct that misconception. From an anatomical point of view, the vertebrae in your spine don't pop out of place. There isn't enough room for them to do that without causing severe neurological damage that would create a very serious situation for the patient. So the question then becomes, well, what exactly happens? Well, it is my opinion that what happens is a loss of normal functionality. The bones and nerves and muscles and tendons and ligaments and the discs that go to make up the human spine all must work together in concert to provide the patient with pain-free, normal mobility and movement. So what happens? Well, what happens is some of these structures become injured. For example, a muscle might be strained, or a ligament might be sprained, or a joint might be irritated. And these things then result in a loss of the normal functionality of the level of the spine where the injury took place. And what I do as a chiropractic physician is I determine the nature of the injury in your spine and then prescribe treatment to get the body to heal this area of injury so as to restore normal functionality. So it isn't so much a structural, this bone is out of place, as it is a loss of normal functionality relative to the vertebra, muscles, ligaments, joints, discs, etc. that make up the human spine.
Okay, thanks. We hear that so often. And what about the perception that it's only for older people and not for children? We have a range of patients from, an infant to someone, several people actually, who are in their mid-90s.
Yes, that's very
true.
It's
amazing.
And I know a lot of times when I'm out in public and people ask me about what I do, and I tell them I'm a chiropractic physician, you must have a lot of older folks as your patients. And my response to them immediately is, as you just commented as a misconception, is chiropractic isn't just for older folks, our seasoned citizens, it's for everybody. Everybody gets functional issues relative to their spines as it pertains to the chiropractic physician. The older folks, I think, are just more commonly associated with stiffness and pain, And people don't realize that, interestingly enough, the largest percentage of patient population in a chiropractor's office is the mid to early mid-aged people. So the conception that it's only for the older folks is just really not a true conception. And I'd like to address one other issue about chiropractic and children. It is very important that children that receive regular chiropractic care, especially if they are complaining of specific issues, as their spines have not completely matured yet. The spine can be easily directed in a more healthful direction, especially if there are some issues evident, and that the child can lead a more pain-free life. Because remember, it's the bumps and bruises and the mileage that you put on your spine as a kid that results in a lot of the aches and pains that we have as adults and older adults.
Well, Doc, you mentioned that about children complaining about something. What would they complain about? What should parents have their ears tuned for?
I think for children, headache is a big one.
Yeah.
I don't think that it's very common for children to be complaining of a headache. So if a child is complaining of a headache, that may indicate that they're having some issues with their spine. Just chronic back pain. Other than that, the child continuing to complain of their back hurting, and they're having discomfort here and there, especially with specific movements or specific motions that they go through. They tell you that their back hurts. That could be indicative of some kind of a problem. And the other thing with children that should be checked out, and I think the school system does a reasonable job of this, and that is scoliosis, evaluating children for scoliosis, because if you catch it early enough, it's possible that you might be able to help them restore a more normal spinal curve so that they don't have to live with that the rest of their life.
Okay, yeah, that's one that we see often in adult patients is scoliosis.
Yeah, you're going to see some curvature in the spine of older folks and adults. That it's possible, had it been found when they were a kid, that it may, or a child, I should say, that maybe they could have had that resolved, when it was resolvable. Now, I'm not trying to say that all scoliosis it can be treated by chiropractic and that we can straighten out spines in every case, because that's not true. But I certainly do think that there are instances when chiropractic would be very beneficial for someone who has a scoliotic curve.
Okay, all right. And another thing that we hear often, in fact, you've heard from me, is that I'm okay, I'm not having any issues.
Yeah, it doesn't hurt right now, so why do I need to be adjusted, right?
Right.
Yeah,
You've pulled me in a couple of times and said, "Come here."
That's right. Pain isn't always the bar that we use to determine if a patient is injured. Please remember, listeners, pain is nothing more than a signal, and it's just one of the signals. Pain is important because it keeps us from doing something to further injure ourselves. So I do understand that. But from a treatment perspective, it is not the only piece of information that I use to determine the health of the patient. So a lot of times patients will have some functional issues in their spine and not necessarily have any pain or any significant pain. They may notice stiffness, or they may not notice anything at all. And that leads to the old adage, one of the complaints that you hear very commonly about chiropractic care is that once you start chiropractic care, you've always got to stay with chiropractic care. You can never get away. And I guess there is truth to that, but it's not a negative truth. It's a very positive truth. And that truth is as follows. Once you've experienced a healthy spine and you know what it feels like to have normal functionality and pain-free motion and flexibility and all of the things that can occur when your spine is healthy, once your spine starts not being so healthy, you're going to know it. And if you know that the chiropractic physician has been the one to help you regain that normal health, guess where you're going to go? You're going to go right back to that chiropractor's office to receive another adjustment and a series of treatments as per needed with your condition. So, I don't think it's a negative thing that once you've started chiropractic, you're always going to have to go back from a negative perspective. It is a very positive perspective, and I see that with my patients all the time.
Oh yeah, feels so good when you've
It does.
when you've done that and you walk out of there with an or a couple of days later.
Yes, it is such a relief. Well, Laura, I'd like to finish up today, if I may, by just thanking you for helping me put the show together. And I hope our listeners have enjoyed the things that we've talked about today. And I would certainly welcome any questions from any of you that would like to send those questions to us to the email that was given to you earlier. And that email is iamchiro1@gmail.com. That's I, M as in Mary, CHIRO1@gmail.com. Or feel free to stop by our office at 275 Tony Pinna Drive right here in Jupiter. That's Suite 12, by the way. Or just give us a jingle at 561-746-4242. And if you lose this information and you still would like to try and get a hold of us, I am sure that you can call the radio station here. That's 103.9 The Jupe. Just give them a jingle and tell them you'd like to get in touch with me, and they'll either get a message to me, or they may even tell you how to get in touch with me, give you my phone number or our address here on Tony Pinna. Well, folks, it's been great, and I've enjoyed my conversation with you, and I hope to be speaking with you on a weekly basis in the time to come. Have a healthy day, and as our motto is, be well, live well.